I'm going to bring it to order. We're going to start as a subcommittee until we get enough members to establish quorum. Today we have 101 bills on file, only 8 of which are eligible for a due pass motion. The remaining bills are suspense items. 4 bills that are listed in the daily file will not be heard today. Those are SBs 119 and 541 by Senator Hill, SB 585 by Senator Leyva, and SB 602 by Senator Monning. We've been told that we will not have a representative from the Department of Finance in committee today. They did not have any files on the bills that are up today due to the May revised workload. Before we call our first author, I would like to again remind the audience to stick to the fiscal aspects of the bill. Please refrain from any lengthy policy discussions in your comments. Sergeants, if we could call the absent committee members and the following authors who are presenting bills so we can get started this morning. Authors presenting bills with due pass recommendations are Senator Hernandez, Senator Liu, Senator Block, Jackson, Monning, and Mendoza. Suspense bills with presentations, according to our staff here, is Senator Mitchell, Leno, Roth, Allen, and McGuire. Why don't we start with Senator Bates? Yeah. Senator Bates, I know you have, you ready? Okay. Why don't we commence with, why don't we commence with our Vice Chair, Senator Bates. Good morning to you. Senator Bates, you have 2 items, SB 257 and SB 722. My understanding is you're waiving presentation on SB 722. Is that correct? Perfect. So then why don't we begin with SB 257. The floor is yours.
There it goes. Thank you, Chair and members. Senate Bill 257 is a simple, straightforward bill that authorizes the personalization of Gold Star family license plates with an optional fee paid for by family members. Giving you a very quick background on the policy issue, Army Special Class Rudy Acosta was 19 years old when he was killed in southern Afghanistan. After serving as a medic for 9 months, he was 6 weeks away from finishing his tour of duty with hopes of becoming a surgeon. To honor his fallen son, Rudy's proud but heartbroken father, Dante Acosta, sought a Gold Star family license plate. His request to personalize the plate as for Rudy was denied, and he was told that personalization of Gold Star family plates are not allowed by California law. I appreciate the committee has been working with me and my staff on the price tag associated with SB 257. Although DMV estimates one-time costs near $400,000 for new programming of this program, I do believe that that certainly is worth every penny, given that these veterans gave the ultimate sacrifice and their families deserve to inscribe the license plates with the personalization they prefer. I have Mike Anderson, I believe. Is Mr. Anderson here? He's not, but he was the initial supporter and organizer of the Gold Star Family License Plate program in California. I chose to present this bill that has been deemed a candidate for suspense because I believe it is important for all of us to consider the policy and fiscal decision we are making on this important issue when we cast our vote on May 28th. I respectfully ask for your consideration to remove this bill from suspense at that time when you have a chance to vote on May 28th. We are working with committee staff on reducing the fee from $49 to $48, but we have a plan in discussion that would actually direct some of the funds to the general fund to reduce the cost, and hopefully that will be considered so that this can come to the floor.
Thank you, Senator Bates. Witnesses in support of the measure? Witnesses in opposition? Questions from committee? Seeing none, we look forward to working with you on this important item as we move into suspense. Thank you, Vice Chairwoman. At this time, we're gonna establish our quorum. Secretary, please call the roll.
Laura?
Here.
Laura, here. Bates? Here. Bates here. Bell? Bell here. Hill? Hill here. Leyva? Leyva here. Mendoza? Nielsen?
We have a quorum. We also are instructed by staff. We are, SB 538 by Senator Block is pulled for today's hearing. Next, we see Senator Hernandez. Senator Hernandez, please come up. We have, you have a number of items, and I believe you're presenting on, well, you have a dual pass recommendation on SB 622.
Correct. I'm going to waive on item number 26, item number 243, item 425, and item 503. I'm going to waive presentation. Perfect. I believe those are suspense candidates.
Correct.
And then I'll be presenting on 622.
Perfect. You may proceed.
Thank you, Mr. Chair and members. The Affordable Care Act has placed about 3 million additional Californians onto our healthcare system, and the recently insured are increasing demand for services on an already strained system. This bill removes restriction in current law so that doctors of optometry can examine, prevent, diagnose, and treat conditions and disorders of the visual system and eye to the full extent of their training. The bill is in front of you today as a result of 3 years of work, which includes hours spent with Chairman Hill. Again, I want to thank him and the business and profession staff when the bill was heard in Policy Committee. Proud to say that after the work on the bill, this bill passed the BMP committee with 9-0 unanimous bipartisan vote. Your analysis indicates that the costs associated with the bill are under $150,000, so the Department of Consumer Affairs can promulgate regulations and issue certificates. I respectfully ask for an aye vote.
Witnesses in support of the measure.
Mr. Chairman, Terry McHale with Aaron Reed and Associates representing California Optometric Association. Chair and members of the committee, this particular bill can claim multiple parentage. The work that was done in the Business and Professions Committee was extraordinary and did lead to a 9-0 vote. We wanted to thank Senator Hill and his staff. The legislation includes 3 certifications that will require each optometrist to complete a minimum of 70 hours of education. They will include computer modeling, intensive testing, and 56 complete procedures on live patients in a clinical setting. At the end of the day, we will be the most educated, most trained, most expert optometrist in the world. The cost is under $150,000. It is absorbable by the board. Mr. Chair, this bill is cost-effective, allows the optometrist to cooperate more fully with the healthcare delivery team, provides access to patients in rural areas and the inner cities, and we ask for an aye vote. Thank you.
Thank you. Additional witnesses in support.
Good morning, Shannon Smith Crowley of Wilkie Fleury, representing Vision Service Plan and support. Thank you.
Thank you. Additional witnesses in support. Please come forward. Witnesses in opposition. Go ahead.
Morning, Jennifer Simoes with the Medical Board of California. We have opposed unless amended position on this bill, but it's not for financial reasons, it's policy reasons. Thank you.
Thank you. Additional witnesses in opposition.
Actually, I'm in support. Dr. Glenn Kawaguchi, practicing optometrist in Ventura, California, also member of the State Board. Thank you.
Thank you. Any additional witnesses in opposition on the measure? Seeing none, excuse me, questions from committee. Senator Hill.
Thank you, Mr. Chair. And no questions, really, just a comment. I want to congratulate Dr. Hernandez for the hard work over many years to come to what I believe is a solution that balances patient protection and access, and certainly the proficiency level that these optometrists will have certainly meets the needs, and with the minimal cost, I think it's appropriate to move forward. Thank you.
Thank you. Senator, any additional comments or questions from committee? Seeing none, there's a motion by Senator Hill. Secretary, please call the roll.
The motion is due pass to the Senate floor. Laura?
Aye.
Laura, aye. Bates? Aye. Bates, aye. Bell? Aye. Bell, aye. Hill? Aye. Hill, aye. Leyva? Aye. Leyva, aye. Mendoza? Aye. Mendoza, aye. Nielsen?
Thank you, Mr. Chair.
Thank you, Senator Hernandez. We'll keep the roll open to allow Senator Nielsen to add on. Senator Hill, would you like to take up your items? I'm sorry. No, I think it's Senator Bell. Senator Bell, are you prepared? Let's do this. Senator Bell, you have a number of items. My understanding is you're waiving presentation on SB 319, 377, and SB 513. And you are presenting on SB 9?
319 I'll present, Mr. Chairman.
319?
I was planning on presenting SB 9, 319, and 44.
Okay. Let's start with SB 9.
319 and 44 are kind of paired in a lot of ways. So I'll present SB 9 first.
Yes, let's begin with SB 9.
Okay. Thank you, Mr. Chairman and members. SB 9 is a bill that ensures the cap and trade funding is invested responsibly in projects that maximize greenhouse gas emission reductions and meets the goals of AB 32 by focusing the program on its large transformative transit projects. Getting people out of their car and into public transportation makes the most sense about where we should invest cap and trade dollars. Transportation-related greenhouse gas account for 40% of emissions. These types of projects are a multi-year effort and require a level of financial certainty for the operators to plan. The bill allows for multi-year funding agreements to address this issue. I wanted to highlight the committee analysis states that transportation agencies estimate SB 9 will have minor absorbable costs to implement the program as envisioned in the bill, which I agree. SB 9 makes minor structural administrative process change just to an existing program, the Transit and Intercity Rail Capital Program, which was created last year through the enactment of SB 862. The committee analysis also states SB 9 creates cost pressures by adding ferry systems as eligible for funds under the program. I would argue that adding another mode of transit as eligible to apply for the funds does not create cost. This bill does not guarantee funding. This is a discretionary pot of revenues that must undergo a competitive process. The Transportation Intercity Rail Capital Program gets 10% of the cap and trade program regardless of whether or not ferries are eligible or not. And also I'd like to point out that this expands the opportunity to get more federal funds into transit and ferries, which this fund actually mirrors the federal process. This is the similar process, a full funding grant agreement, multi-year funding that the federal government has. So it gives us in California a chance to maximize our federal dollars that we can match. Thank you, and I respectfully ask SB 9 be lifted from suspense, sent to the floor where it deserves a vote on its policy merits. I think this will result in more money for California from the federal government, and it's good to do long-range planning of large transportation projects. Thank you.
Thank you. Witnesses in support.
Thank you, Mr. Chairman and committee members. My name is Kurt Evans, and I'm with the Santa Clara Valley Transportation Authority, and we're supporting SB 9. I would like to briefly emphasize one point. SB 9 does allow ferry transit projects to compete for funding under the Transit and Intercity Rail Capital Program. However, we agree with Senator Bell. We don't see how there would be cost pressures on the Greenhouse Gas Reduction Fund, given that the Transit and Intercity Rail Capital Program can only receive 10% of the money, no more, no less. We respectfully ask for the committee to pass this bill. Thank you.
Thank you. Go ahead.
Good morning, Mr. Chair and members. Chris Rosa, representing the Silicon Valley Leadership Group, in support of the bill.
Thank you. Additional witnesses in support. Witnesses in opposition. Please come forward.
Good morning. Steve Wallach on behalf of the Alameda Contra Costa Transit District, the Napa County Transportation Planning Agency, and CalAct, which is the California Association for Coordinated Transportation. We have an opposed unless amended position on this bill because we don't feel that the 90-10 split that's currently in there is equitable. You know, most of the projects are below $100 million. Actually, the vast majority of them are below $100 million. And we feel a better split would be something, a lower threshold, a different split. We are trying to we'll meet with the senator to try and discuss these and try to work out a more equitable division of these funds.
Great, thank you. Additional witnesses in opposition. Comments or questions from committee? Seeing none, Senator Bell, would you like to close on this item?
Thank you. And I urge support to be considered. We will get more federal money if this bill passes. Thank you.
Thank you. Without objection, this bill will go to the suspense file. The next item you have is SB 483. Is that correct?
319.
Oh, 319.
And 44. These are two bills. Other bills I'm waived.
Okay. Which is the one you said?
319 and 44.
Okay, let's continue with 319.
Okay.
Go ahead.
Thank you, Mr. Chair and members. The two bills I'm presenting now are related to the use of psychotropic drugs in the foster care system. So I'll be addressing that issue in these two bills. This is a package of bills by three senators, Senator Mitchell, Monning, and myself, that have introduced as a package to reduce and hopefully manage properly the use of psychotropic drugs among our foster youth in California. Mr. Chair, members, nearly 1 in 4 foster care and 56% of children in group homes are receiving psychotropic drugs without adequate oversight. Now, I realize there are some cases that warrant psychotropic drugs, but the state must ensure that these powerful drugs do not replace other effective and necessary treatment. These drugs should only be used as a final alternative after other treatment options are exhausted. This bill, SB 319, utilizes the public health nurses to oversee the medical monitoring of foster youth psychotropic drug use. Existing data shows that there are between 10,000 and 12,000 foster children currently prescribed psychotropic medication per year. Now, based on this information, we estimate that around 5,000 children in California need close attention to the recommended baseline screening, periodic monitoring, and lab testing by public nurses. The duties required for public health nurses under this bill qualify for federal match reimbursement at an enhanced rate of 75% through Medicaid or Medicare. With this match, we anticipate the actual cost of this measure to be just over $1 million annually. Further, over the last decade, the state spent more than $226 million on psychotropic medications for foster youth. So we're doing this bill to lower that amount. So if this bill passes and the $1 million invested in the nurses takes place, we will lower the cost on the other side, which is the cost of the drugs that are given to these children. So it does have a countervailing reduction. And if we can use an example, if we take a 25% reduction in the use of drugs by the foster youth out of that total, this state would save $5.65 million annually. Thank you. I request that this item be lifted from suspend and be sent to the floor at the proper time when it will take place for a vote, which it deserves. Thank you.
Thank you. Witnesses in support.
Nicole Wortelman on behalf of the Alameda County Board of Supervisors. This measure would address a longstanding problem in the foster care system and provide medical oversight for children that desperately need it.
Thank you. Go ahead.
Thank you. My name is Anna Johnson from the National Center for Youth Law. We are the sponsors of this bill, and thank you, Senator Bell, for your leadership. SB 319 addresses in many ways both the cost and safety of the over-medication of foster youth with psychotropic medications. These are costly and dangerous to the state, and we just want to make sure that each foster child has the eyes that any child would typically have of a parent. And so what typically doesn't happen with foster children is that they are followed and monitored, and public health nurses are that great resource to do that monitoring. With the 75% federal match to our investment as a state, we'll be drawing in federal funds. We'll also be reducing what we're already paying for, which is about $25 million a year on the pills themselves for just foster children. We'll be reducing the hospitalization costs when these side effects happen. We'll be reducing the number of children with long-term disabilities that are sent into the adult system of care, which is very costly to both their livelihood and to the state. And we'll really just be investing in every child's future, and I thank you for your support of this bill.
Thank you. Additional witnesses in support. Witnesses in opposition of the measure. Comments or questions from committee? Senator Bell, would you like to close?
Thank you. Urge support for this bill.
Thank you. Without objection, we will move this item to the suspense file. Next, you have SB 484.
Mr. Chair and members, we just heard in the last bill that the startling percentage of 56% of children in group homes are receiving psychotropic drugs without adequate oversight. We just heard that. That's actually the facts. And it's really interesting that that's the facts when you take a family foster care home and it's only 1/4 of that amount of use of psychotropic drugs in a family foster home, Mr. Chairman. So this is the bill. This bill addresses that particular issue. More than half the children in group homes are medicated with one or more psychotropic medications, and 65% of the children living in group homes are prescribed medication and given an antipsychotic. 61% are given antidepressants, and hundreds of children living in group homes are given multiple medications long term. This bill, SB 484, established treatment protocols and institutes oversight measures in group homes. This is specifically necessary because group homes are by far the highest cost foster care services you can get. Plus, at the same time, it turns out they are by far multiple times higher in terms of use of psychotropic drugs. So we need to have the bill passed because the department, it will allow the department to use existing data collection model and stakeholder work groups to develop a methodology to monitor and analyze group home psychotropic drug use. Further, this bill utilizes the stakeholder work groups to develop a corrective action plan for those group homes that are deemed unnecessarily overprescribing psychotropic drugs. Due to this, the long-term cost is under $500,000 annually. I'd like to point out that group homes receive additional stipends if the children are medicated. So if we reduce medication and make it at a proper level, this could result in some cost savings in that regard. Thank you, and I urge this measure be lifted from suspense and sent to the floor. Thank you.
Thank you. Witnesses in support of the measure.
Hi, Anna Johnson, National Center for Youth Law. Again, this bill was developed with Senator Bell in the hopes of reining in what we know are hot spots of overprescribing of foster children. There are many reasons why a child in a group home is more vulnerable to multiple medications and long-term use of powerful drugs. And we want to use the clinical guidelines and some of our medical expertise to really look at where are they not doing the screening and monitoring, where are they not providing other services, and where are they providing multiple meds above the FDA maximum dosage for adults for children. So that would lead to that, and understanding that these are actually the sedation effects, or where are those combinations of drugs being used where it could lead to those long-term disabilities where the studies show this is a dangerous combination. And what SB 484 does is use the data that we already have been developing over time to find those hot spots and develop corrective action plans and say, this is what kids need instead. You need to reduce this. And again, by reducing that use of medications, we are saving the state money. We're saving children from these dangerous side effects. And again, this bill is very low cost in the thousands of dollars to really target where the majority of overprescription is happening. I think it's a great investment for our state. Thank you.
Thank you. Additional witnesses in support. Witnesses in opposition. Senator Bell, would you like, questions or comments from committee? Senator Bell, would you like to close?
Just that over-prescribing these medications and using them for chemical restraint, we call it, really destroys the opportunity the children have for education. And I think looking at the lives of the children, it interferes with their education if they're overprescribed these psychotropic medications. I urge support for this bill.
Thank you, Senator Bell. Without objection, we move this item to the suspense file. Senator Monning, please come forward. Senator Monning, you have 3 items. You have a due pass recommendation on SB 561.
Yes.
Let's begin with that one first.
Okay. Good morning, Mr. Chair and members. SB 561. In the fiscal year of 2013-14 alone, the Contractor State License Board received approximately 800 applications a month to register individuals as home improvement salespersons. This number is an increase of 40% over the prior 3 years. The number of applications received per month has continued to grow since then, while the number of staff to process these requests has remained the same, resulting in significantly increased processing times for each request. SB 561 will address this problem by eliminating the requirement for an HIS to register to work for each contractor individually, and instead will streamline the IHS registration process by requiring contractors to notify the Contractor State Licensing Board when a registered HIS is working for them, allowing the HIS to work for multiple contractors once the appropriate notification has been given. Recent amendments authorize the acceptance of electronic signatures in order to facilitate online registration and renewal. Any costs associated with implementing these provisions are absorbable costs by CSLB. We've received no opposition to this measure, Mr. Chair and members, and I'd like to have our witness, Laura Zuniga from CSLB, provide brief testimony in support. Thank you.
Witnesses in support of the measure.
Laura Zuniga with the Contractor State License Board here in support, and also just want to note again that CSLB can absorb any costs related to the bill.
Thank you. Additional witnesses in support. Please come forward.
Matt Klopfenstein with the California Solar Energy Industry Association, also in support.
Thank you. Witnesses in opposition. Seeing hearing none, committees or comments or questions from committee members? The motion to move the bill by Senator Hill. Secretary, please call the roll.
The motion is due pass to the Senate floor. Laura?
Aye.
Laura, aye. Bates? Bates, aye. Bell? Hill? Hill, aye. Leyva? Leyva, aye. Mendoza? Mendoza, aye. Nielsen? Nielsen, aye.
Oh, yeah, we'll put that bill on card, so allow Senator Bell to add on. The next two items you have are suspense candidates, SB 253 and SB 315. Let's start with SB 253, please.
Thank you, Mr. Chair, members. I know this is a candidate for suspense, offering just some brief testimony. SB 253, this is consistent with what you just heard from Senator Bell in a combination of bills addressing juvenile court's process for authorizing psychotropic medication use by foster children. This bill mandates the application of healthcare standards by the judiciary when authorizing psychotropic drugs to children in foster care. No psychotropic drugs would be authorized without prior medical exams of the children, and ongoing monitoring must occur. For treatments with the greatest risk, a second opinion from a psychiatrist must be obtained. The data is very troubling. Nearly 1 in 4 foster youth receive powerful psychotropic drugs. Of all the children taking psychotropic medications in California, 52% are antipsychotics, which have risk factors that can lead to lifelong disabilities such as tremors, obesity, and diabetes. 48% of foster youth are given antidepressants that have an FDA black box warning for use by children. We, the state of California, assume the role of the parent for foster youth. It is the job of the legislature to address the problem for a voice that does not often get heard. SB 253 seeks to address this issue. Respectfully ask for your aye vote at the appropriate time. And Mr. Chair, would like to present Anna Johnson with the National Youth Law Center here to testify in support.
Thank you. Witnesses in support.
Thank you, Anna Johnson, National Center for Youth Law, and thank you, Senator Monning, for your leadership. Chairman and members of the committee, as we've discussed, the over-medication of foster youth is costly and dangerous to children. Right now, judges in our California courts hold the decision to determine if a child can take a psychotropic medication. And what this bill does is basically lay out for the judge what the clinical standards are to review so that they can make a decision, is this in the best interest of the child child, and is all the information there for them that they need to make such a decision. Again, when we don't have a parent tracking the child and their health over time, they might not know that these medications have already been tried and didn't have a good impact. They might not know that there hasn't been anything else tried first. A parent usually wouldn't go to the most invasive treatment first when they take their child to the doctor, and that's what we're asking our judges do, that they be that parent and that they actually have the medical support in the medical community to do that. This bill, based on the analysis, we do want to discuss a couple of the fiscal items that we think will actually be a little less costly. The social worker's role here, we think, is a little overstated. It's really the medical professional's responsibility to fill out the forms, to make sure the information's there, and to communicate that correctly with our what's called a JV220A form. And essentially, we don't think that the social worker is going to identify if they should have a second opinion. That's really the role of the judge based on the guidance. So, and then finally, with medical examinations and lab screenings for children in foster care, about 47% of children in foster care are in managed care setting. Those second opinions are covered in a managed care cost package, and the children that are in fee-for-service Medi-Cal receive federal funds at 50% of the cost of those services. So we think, again, there might be, based on the number of children that need this, the cost would be lower. So we're happy to work with folks on those moving forward, but total, we think this package will be less than $8 million for all 4 bills, and 253 is that preventative step that we need to make sure that this is safe for every child and to reduce those same costs we mentioned earlier of costs of excessive medication, excessive dosage, and long-term use. So thank you so much.
Additional witnesses in support.
Nicole Wertelman on behalf of the Alameda County Board of Supervisors, also supporting.
Thank you. Additional witnesses in support on this item. Witnesses in opposition, please come forward. Seeing none, comments or questions from committee? Seeing none, Senator Bonning, would you like to close?
Just respectfully, we'll ask for an aye vote at the time that would be appropriate, and hope this can move from suspense. Thank you.
Thank you. Without objection, we will move this bill to the suspense file. Your next item is SB 315. Senator Bonning, the floor is yours.
Thank you, Mr. Chair, members. SB 315 authorizes the California Health Facilities Financing Authority, CHAFA, to start a second California Health Access Model Program, or CHAMP2 grant program. The funds used will not adversely impact the existing CHAFA loan program, and CHAFA has experience with the first CHAMP grant program. The grants are expected to increase health access and improve clinical outcomes for vulnerable populations, and as a result, achieve cost savings in our healthcare system. Sponsoring this bill is State Treasurer John Chung, and here to answer any questions, we have a representative from the Treasurer's Office. Respectfully ask for your aye vote at the appropriate time. Thanks.
Thank you. Witnesses in support.
Good morning. Carolyn Abu-Bishar from the California Health Facilities Financing Authority, available to answer any questions.
Thank you. Additional witnesses in support of the measure. Witnesses in opposition, please come forward. Seeing none, comments or questions from committee? Senator Bonning, would you like to close?
Respectfully ask for your aye vote at the appropriate time. Hope we can move this off suspense and reduce long-term costs to the state. Thank you.
Thank you. Without objection, this bill will move to the suspense file.